Flank pain shooting down to the groin? That's a classic kidney stone, something you'll see on exams and in real life. The USMLE loves these questions, and knowing the stone type is your secret weapon. Shape, pH, risk factors, treatment. Each is a clue, and they're all testable. So let's break down kidney stones crystal clear. First up, calcium stones. These are the most common, making up about 80% of cases. There are two flavors, calcium oxalate and calcium phosphate. Calcium oxalate stones are the real MVP here. They're shaped like envelopes or dumbbells, show up in urine with low pH, and are radiopaque on X-ray. Watch out for risk factors like ethylene glycol poisoning, too much vitamin C, chronic diarrhea, or Crohn's disease. Treatments: think thiazide diuretics, citrate supplements, and a low-sodium diet. Now, calcium phosphate stones are less common. They look like wedge-shaped prisms, show up in alkaline urine, so a higher pH, and are also radiopaque. Treat them just like oxalate stones, thiazides, and low sodium. Moving on to ammonium magnesium phosphate, aka struvite stones. These are infection stones caused by urease-positive bugs like Proteus, Klebsiella, and Staph saprophyticus. Urease breaks down urea, makes the urine alkaline, and boom, coffin lid-shaped crystals that are radiopaque and can grow into giant staghorn calculi. Treat the infection, and if the stones are huge, surgery is the move. Uric acid stones are up next, making up about 5% of all stones. These are sneaky, shaped like rhomboids or rosettes. They form in acidic urine and are radiolucent, meaning they won't show up on an X-ray, but you'll spot them on CT. Risk factors: dehydration, hot climates, gout, or anything causing high cell turnover like leukemia. Treat with urine alkalinization using potassium citrate, allopurinol if needed, and always hydrate. Last but not least are cystine stones. These are rare, genetic, and show up in kids. It's an autosomal recessive defect. Think cholecystine, ornithine, lysine, arginine. The stones have a classic hexagonal shape. Remember, 6-tine stones have 6 sides. They're seen in acidic urine and are faintly radiopaque. The sodium cyanide nitroprusside test can help diagnose cystinuria. Treatment: low-sodium diet, alkalinize the urine, and chelators like penicillamine if things get tough. Here's how I remember the trickiest bits. Radiolucent stones? I can't see you, that's cystine and uric acid. Cystine has 6 sides, struvite is for staghorn and strong bugs. Alright, let's rapid-fire recap. Calcium oxalate envelope or dumbbell, low pH, radiopaque, thiazides plus citrate. Calcium phosphate prism, high pH, radiopaque, treat the same. Struvite, coffin lid, high pH, radiopaque, infection and surgery. Uric acid rhomboid, low pH, invisible on X-ray, alkalinize and hydrate. Cystine, hexagon, low pH, faintly opaque, low sodium, chelation for the win. Remember, stone type equals shape, pH, risk factors, and treatment, all exam gold.